That's right, Robin. You know, we're going to talk to one of those 25 undecideds right now. One of the men President Obama may be calling today, Congressman Jason Altmire of Pennsylvania. He voted against the House bill last year. Now he is on the fence. He is hearing from all sides, and he joins us now from Washington. Good morning, Congressman.
Good morning, George.
So you have talked to the president at least 3 times so far. You're getting thousands of emails from your district. You got Tea Party activists camped out on the other side. You feeling the heat?
Well, in my district, it's been unbelievable. We're getting phone calls and emails by the tens of thousands on this, many of which are from the district, but we're getting them from all around the country. There were 2 planes in Pittsburgh flying over the city yesterday saying, tell Altmire to vote no on health care. I've never seen anything like the passion of this, but that's because health care is such an important issue.
It certainly is, and as we said, you voted no the first time around on the House bill. What specifically do you need to see to change your vote from no to yes?
A couple of things. I need to see better cost containment than was in previous versions of the bill. That means bringing down the cost of health care for families and businesses and seniors, Medicare beneficiaries, people who have insurance now, but also bringing it down for the government. The long-term cost projections are simply unsustainable, as you know, and previous versions of the bill had costs actually increasing for the federal government over time. I can't vote for something like that this time.
Well, the House bill was about, what, $950 billion. The Senate bill came in at about $875. What number do you need to see?
It's not about the number of the bill. It's about bringing down the cost of health care and slowing down the trajectory. I can make anything achieve balance if you raise taxes high enough. I'm not interested in just moving money around and changing who pays. I want to see systemic reform, changes in our delivery system that are going to incentivize quality over quantity, because the insurance reforms in this bill are strong, the coverage provisions are strong, but the weak link, which you have to all do together, is delivery system reform. That's what I'm looking for.
You've spoken to the president at least 3 times. Take us inside those meetings and phone calls. What's his pitch?
It's a continuing conversation. I'm on one of the committees of jurisdiction. I've been in touch with the congressional leaders as well as the administration, and they know what my concerns have been, and the conversations with the president recently have been walking through what the changes in the bill have been over time. He says, look, you were concerned about cost containment in the initial version. You were concerned about the income tax increase, which is no longer in the bill. You were concerned about the employer mandate. That's no longer in the bill. And these are the reasons why he thinks that we're getting closer to getting a bill I can support.
But he hasn't sold you yet. You know, yesterday when Congressman Kucinich announced that he was switching his vote from no to yes, he said that one of the factors guiding his vote was the fact that if this went down, it would cripple President Obama's presidency. How big a factor is that for you?
I'm not worried about the political implications of this. This is too important to vote. It's the biggest social policy this Congress has taken up literally in 45 years. And I have 135,000 Medicare beneficiaries in my district. That's a big part of the calculation. I'm a representative. I'm focusing on what this is going to do to impact my district.
You know, a lot of opponents of the bill say that if you vote yes, you're going to lose.
Perhaps, but whether I win or lose, or I'm in Congress or not, I still have to live in Pittsburgh, and I still have to look my friends and family in the face and my neighbors, and I have to know I did the right thing. And that's what this is all about. There's nothing more important than doing the job I was elected to do, and that's representing my district.
Okay, Congressman, it's Sunday afternoon. The vote's been called. The clock has run out. The Democrats are stuck at 215 yes votes. Speaker Pelosi comes up to you on the floor. The president gets you on the phone and says, it is all up to you. Can you imagine voting no under those circumstances?
I'm not going to let myself get in that circumstance, because I think I have an obligation to both sides who are counting the votes to let them know where I am, and I will more than likely make a decision before the vote so everyone will know where I am.
Okay, Congressman Altmire, good luck with your decision, and thanks for joining us this morning.
Thank you, George.